We had GHB for our drug, which is also known as a date rape drug.
The term date rape refers to a rape in which there has been some sort of sexual relationship between the two parties, where the act of power is initiated by the rapist and the other person is unconscious or not wanting to have sex. GHB has been implicated as date rape drug because it was found by doctors to prevent the person who was given it from resisting sexual assault.
Rufinol is often thought of as the same drug as GHB. However, there are differences in their symptoms and physical appearances as well.
Rufinol is under the classification of a depressant, as it depresses or slows down the nervous system. It is a tranquilizer and more specifically a benzodiazepine, which is a minor tranquilizer. These types of drugs lower anxiety and reduce stress.
The physiological effects are dose-dependent. This drug releases GABA and glutamate, and those contain molecules that produce the main neurotransmitters of inhibition and excitation and are identical to those observed during non-conclusive epilepsy seizures. Low doses result in a decreased inhibition, but also have a feeling of euphoria. High doses result in extensive muscle relaxation, disorientation, sleepiness, and lethargy. Confusion, loss of coordination and balance, decrease in heart rate and respiration, and impaired learning and memory. Overdoses result in an extreme level of what high doses do, but also include headache, nausea, vomiting, hallucinations, seizures, amnesia, respiratory depression, loss of consciousness, coma, and possibly death.
Higher doses typically produce a longer time of effects and duration of action. Sexual behavior is not a typical action. Some effects include agitation, soaring heart rate and blood pressure, and profuse sweating.
Some of the examples of this drug effects on the behavior include extreme violent behavior, vomiting, wild hallucinations. For short-term effects and long-term effects range from strange behavior, inability to maintain jobs or relationships, and major withdrawal.
This graph shows how GHB has been an increasingly used drug, and the medical injuries related to the date rape drug have seriously increased.
It is now time to discuss. Our discussion questions are: with the new techniques that have come out for women to prevent date rape, is it the responsibility of the woman to use those techniques, or is it the responsibility of the male to understand the boundaries? Should people be checked or searched before going into clubs?